Hi, my name is Oyunga Pala. Welcome to another podcast from The Elephant. With me in studio today are members of the KMPDU, which is the Kenya Medical Practitioners, Pharmacist, Dentist Union. I always get mixed up with that double P. Yeah? I'd like to introduce themselves. I've got Mr. Dr. Oluga here, Dr. Mwachonda, and Aiyabel. Kind of just sort of like introduce yourself in terms of your professional background and your position in the union.
Okay. Yes, my name is Dr. Ouma Oluga, and I am the Secretary General of the union. It's quite a mouthful for many people, but sometimes you can just say the Doctors Union. Which is the union that represents medical practitioners, or the traditionally called doctors, and then the pharmacist, and then the dentist. Okay. So that's my position. Secretary General also is the spokesperson, officially of the union.
My name is Dr. Mwachonda Chibanzi. I'm the Deputy Secretary General of the Kenya Medical Practitioners, Pharmacist and Dentist Union, which is the Doctors Union. My role is basically to deputize my colleague here. We work together, so that's the office of the Secretary General. And as you said, apart from being the spokesperson, communication is our key role in the office and coordinating the internal activities of the union. I'm still I'm a general medical practitioner, so I'm yet to become a specialist.
Yes, my name is Aiyabel. I'm Vice Secretary of KMPDU North Rift, where North Rift has around 8 counties, inclusive of Teaching and Referral Hospital and Moi University. The office of the branch secretary is mainly to be the link between the national and the branch, and also to inform members in the ongoings, both at the national, and also to whip up members at the grassroots so that they respond to the call of the national office.
So gentlemen, karibuni sana, welcome to The Elephant.
Thank you very much.
So let's just get into it. Perhaps maybe I'll start with Dr. Mwachonda. Can you give us a brief history of the union? When did you guys come into existence? What informed the existence of the union?
I like to start off the history of the union from 7 years ago. That is in 2010. It began with agitation for change by a group of young doctors. In fact, they were still in their final year in school.
This is what?
Nairobi University, here in Nairobi, and some in Moi University, because those are the two main universities that were training doctors in Kenya. So the doctors, these young doctors in their final year, were keen to know what is it outside once you complete school. So in the conversations with the senior colleagues, they got to realize that the stories that they were getting from their senior colleagues were not very impressive in terms of work conditions, in terms of remuneration, in terms of fulfilling what you actually trained for. So once they had these discussions, they realized it was important for them to have some change in the way, change the narrative of the doctors. Formed a group. In fact, it's quite interesting. It started from a social media group, a Facebook group. They had this discussion. They started having meetings. Incidentally, the same year, doctors who were due for training, that is postgraduate training at the Ministry of Health, had been denied that opportunity, and the government was now, the government through the Ministry of Health was first moving towards scrapping off postgraduate training. So the young doctors were being locked out of a career. In terms of the career path progression, they were unable to see the picture. So that started off the agitation for change, because things had to go differently. The most coincidental thing that happened is that around the same year, August 27th, 2010, Kenya promulgated a new constitution.
What opportunity did that present at the time?
That's what I was getting to. In that same constitution, Article 41 is solely on labor issues. Every worker has a right to go on strike, have a right to employees and unions, that is sub-article 5, have a right to participate in collective bargaining agreements.
Right.
So that clause that everyone who's a worker has a right to join a union and participate in activities of a union gave these doctors that chance to now form a union.
Yeah.
And that's where the idea to conceive Kenyan Medical Practitioners, Pharmacists and Dentists Union was conceived as a bid to push for reforms in the healthcare sector.
Who were the original, maybe I could move that to Dr. Oluga. Who were the original founder members? Because I know there's a group before you guys. Is Dr. Onyimbo?
Exactly. In fact, I wanted to talk about Dr. Nyimbo Kerama because the history is dates even way back. There are a number of books that have been written from 1968 when KMA was formed, and then KMA was at that particular time only Asian doctors were allowed into KMA, and then in 1972 doctors were trying to form another group.
And so KMA, the Kenya Medical Association?
KMA is the Kenya Medical Association, and it was registered as a company then, limited by guarantee. But even the African doctors then were not allowed to be members of KMA. So there were a number of issues, and then doctors then were trying to form a group in 1972, which they actually called KMPDU. So this name is not very unique to us. In 1994, in 1981, doctors were on strike again, 1986, 1991, and then there was a very big strike in 1994, which took 6 months. In fact, that strike is one of the biggest strikes, but now that strike wasn't successful because it was crashed and doctors left. 2/3 of the Kenyan doctors left the country. If you look at the July issue of the magazines then, including the African Review, they say the headline was "Give us a union." That union was KMPDU. So the doctors then wanted KMPDU. But now come to 2010, and you asked about the constitution and also the people. Now the constitution is what gave this union power to exist. Because before the 2010 constitution, doctors were not allowed to have a union. And that was the reason that was being given then by government. But it's been a struggle that many people have paid very heavy price for. So even just having a union alone is something that we doctors really cherish. So in 2010, there was, of course, all those issues that came. And I remember then I was a medical student. And I was the president of all the medical students in the country. So we organized a conference at Moi University, and we invited Professor Nyong'o, who was the medical services minister at that time. And he began to speak, and he was speaking things that were not very good for this young doctor. Said, we were about 300 of us in that hall, and we had prepared very specific questions for him, which he wasn't answering, and he was not very pleased because I was sitting with him and he started asking me, "Why did you invite me?" And I told him, "Prof, you have to know that things are changing, and by next year we will have a union." So that time Onyimbo Kerama was already a doctor in Thika, and he was one of the people who are now organizing doctors. They used to meet under trees, they used to meet at Freedom Corner, and they really inspired us then. And he paid the ultimate price because he was interdicted and later on sacked. In fact, Onyimbo Kerama does not work in this country. He works in Congo. And he's the symbol of the struggle that KMPDU has been, because right now he makes a living. He's a doctor for some of the mines in some very tough weather conditions in the Congo forest. So basically him, and then there were other colleagues, Dr. Ngani, who was our first chair.
Who was the lady who became a face?
Yes, Dr. Ngani, then we have Dr. Wamboi. Yeah, Dr. Wamboi, a very powerful lady, She really would move people and even government then. Dr. Gott, Akuna, we had Sultani Matindechero, my immediate predecessor. Yeah, so they worked under very difficult conditions. One, when doctors didn't know what it means to have a union. And then two, they are the ones who registered this union. Yeah, and even before they registered the union, it was a year of struggles. In fact, in 2010, the government had stopped paying for training of doctors. And that really pushed them. And even Dr. Ngani himself, I remember he was in the private sector. Dr. Mati Muturi, he now works in the private sector with the pharmaceutical company. So some of them had to quit government completely because they had to be pushed out. Even Dr. Ngani works for the private sector at Mata. So that's how difficult it has been, and yeah.
So when did the actual union, this 7 as we know, when did you guys come together?
So for us, when the union was registered in 2011 with this group, our predecessors, the national officials, most of us now, when we were trying to set up the union structures, became branch leaders. Right. Like for him, he became a representative of the younger doctors, the medical interns. Myself, I was a secretary at Western Branch. In fact, immediately I left Outspan. I told you I worked in the mission, then I went to private sector. When I left private sector, I went to Vihiga. Right. And when I went to Vihiga, that was the conversation, and my colleagues were like, yeah, we want to elect you as our secretary, and that was Western Branch. Yeah, so that's how most of us came and worked with the other group. So, we've had a lot of challenges as a union in between also. So when the other group was sort of leaving in 2014, December, that's when we were now elected into office. But we had been there as branch leaders or playing different roles. Yeah. Yeah.
When did the comprehensive agenda for healthcare reform really begin? When did it crystallize as an idea?
The motto for our union, even now, is healthcare is right. And we ourselves within have really debated, why do we have a union motto of healthcare is right and you're a union? And it's even a discussion that our members, they keep asking us, no, stop pursuing this healthcare agenda. Pursue the rights of doctors and welfare. Right. Yeah, but I believe, and I've come to understand that the people who began this union, people like Dr. Nyimbo Karama and even our predecessors, they had a bigger reform agenda for healthcare other than just doctors' welfare. Right. Yeah. And that is when I think the issue, because in fact the reasons why the union was formed was not even salaries per se, it was more of training. When the government withdrew that training sponsorship for doctors, I think that is the straw that broke the camel's back.
It was the tune of how much was it? What is the actual figure?
It was about 200 million then. And let me just say this, there's a lot of history to it. So since from the 1990 to 2010, doctors had been training, sometimes specializing, but they were never being given degree certificates. So, they sometimes you go outside there, you are a specialist, but actually you don't have those papers because government has retained those papers. So that was one of the ways they were oppressing the doctors. So one of the ways that this was happening is that they were withholding school fee to pay to the universities. So the universities do not give you this certificate. Right. And for a long time, the training of doctors was fully government dependent. In fact, until very recently is when the what I call privately sponsored people came in. Like now people can pay for themselves, but otherwise training of doctors has fully been government hands. And in many countries it's actually government driven. Many countries actually over the world. So because that's one of the ways to ensure quality, because you're not going to ensure quality if you don't control training. So then they denied the training. So in 2010 they were even withdrawing that. So that's, and then when we spoke, as you said, the doctors were speaking to the senior colleagues. Then you realize that you respect this guy so much. This guy is a professor of gynecology, but he has no papers. And now doctors were quiet. They were not saying all of these things because the society expects something different of you. So we said we are not going to live like that. Yeah.
And that's all. So, and then let's get some views from Bay.
When you talk about health reform, I think also after the union came up in early 2012 registration,
right,
there was a strike in 2011, which outcome was now how do we reform healthcare? So there was a Muslim Task Force report, which was meant to look at, because the doctors were complaining about the working environment,
right,
and the equipment. So the task force was in a way to to help the government come up with how to improve the health facilities in the hospitals. And then again, the outcome of that was now the need to negotiate a CBA.
Yeah.
So in one way, it was improving the remuneration for doctors, at the same time looking at the health sector reform, and the task force actually helped in looking at the working environment.
In fact, just to add on to the Musimi Task Force report, which is a product of the 2011 strike, it's titled Strengthening Health Service Delivery in Kenya. So it did not look at it from the human resource aspect only, it also looked at it from the infrastructural aspect. And if you get a copy of that report, it's actually online, you'll be able to understand how the entire healthcare reform agenda is very well captured in this report.
So let's talk about the actual anatomy of the strike. So when did you guys actually set out notice to begin a strike? What date was that?
So, if you look at the anatomy of the strike, this strike actually was a continuation of the 2011 strike. So in December 5th, and it was 5th of December 2011 when the other strike began. The strike that also began this time was also 5th of December. So for us, it was more of a 5-year. It was more of a 5-year commemoration in sorts. But so that strike had 13 demands. The one in November, and some of us, we were very young. We were just I don't know whether you were still a student. Myself, I was a medical intern. It had 13 demands, and out of all those 13 demands, only one was about remuneration of doctors. So the other 12 demands was to do with the staffing of facilities, equipment, particularly financing of the health sector. It had to do with the pillars, health information management. It had to do with the quality of service provision to patients. It had even to do with the supply of medicines and commodities. Now, because at that particular time, the government told us that we could not discuss all of these issues. So they said, let's call off the strike, which was done on Jamhuri Day, which the 12th of December of that year. Let's get this money, then we form a task force. So the task force was formed. It was formed by 3 people from the union and 3 people from the Ministry of Health. So they came up, they looked at all of these things, then they came up with 6 key issues. Now, those 6 key issues, one of them was the issue of the CBA. So they said that all these issues, we need to negotiate a CBA with you. That was in 2012 now, February. Then the other issues of financing of the health sector, equipment. So the equipment bit was done by the government when they came in, the managed equipment services. The thing that the government has been talking about, we are equipping hospitals. It's actually a blueprint of the union, which as part of the Musimi Task Force report. Then there was the issue of financing of the health sector and how it's going to be done. There was the issue of the National Hospital Insurance Fund. There was this issue. Then there was the issue of the CBA. So out of all those big 6 issues, the government had started doing 2, and there was now on the 3rd one, reforming of NHIF, increasing numbers. But all these things were being done, but they were not committing anything at all on the issue of the collective bargaining agreement, which is now the one that was dealing with the human resources for health as far as doctors are concerned. So we waited for 5 years since then. They negotiated the CBA, which then was hurriedly, we can say, signed. Then the government rejected that CBA. They disowned it, but then they signed it. So actually, up to now, we believe that was a validly signed CBA in 2013. So when they signed the CBA in 2013, for us, we knew that now we are beginning to have a good relation. So we waited again, 2014. Nothing happened. It was never even registered. 2015, now when we were the leaders, we said, no, there's a problem here. Let's revisit this issue of the CBA. So we started a lot of meetings. In fact, the meetings began in 2014 with SRC, with the government. I remember at one time we brought all government agencies to Laiko Regency. At another point, we even ourselves as a union funded another meeting at Pan-Afric in June of 2015, which brought all governors and told them, we have this issue. We agreed with you in 2011. We had it in a return to work formula. We had it in a task force. We want to conclude this issue. Again, it wasn't taken very seriously. We went to court after that. So after, then the court found that the government was at fault, gave them 30 days. That was now, the court took 1.5 years. And then when the court gave 30 days, again we wrote 3 letters, called for meetings, nothing happened. Now we decided 5 years is a long time. We have done the meetings, we've done the court. We now have this constitutional right to go on strike, and we thought that was the last mechanism that we would use to bargain. Yeah. So we issued the strike notice. We actually did issue a 21-day strike notice. The law only requires 7 days. We said, okay, so 30 days has ended. We waited for another 15 days, making it 45. And then after the 15 days elapsed, we issued another 21 days of a strike notice. Within those 21 days, we called governors, and we met 7 governors in Mombasa, White Sands Hotel, on the 21st of November, 2016. Right. And we told them, this strike is going to happen if you don't do anything. This is how we want to solve this issue. We even advised them, we told them that the problem is not you, the governors. The problem is Treasury. The problem is issues of policy here at the Ministry of Health. So if you'd look at it that way, then it is easy for you to go and even engage and negotiate with Treasury or negotiate with the SRC, because this problem was there before counties came. Yeah. And we thought that they had listened to us, but I think when they later met, they took, as you said, I think issues of labor are taken not very seriously, partly because of how the unions have engaged or organized, but also partly because the government simply bargains by not bargaining. So they bargain with you by not bargaining. That's their...
So they're basically stonewall.
Yes, it's a stonewall. That's how the government bargains. So they say, so us, and we made a very clear decision, because this had been 2 years, and as the Secretary General for 2 years, for me, I was very clear in my mind. If you're not going to bargain, we will also not bargain.
So, yeah. And the intricate details of the genesis of the dispute was the CBA 2013, culminating in what we now have, a CBA 2017. That CBA was negotiated it was signed on June 27th, 2013. It had a 2-year life cycle that was expiring on 27th June of 2015. So on 25th June 2015, we resolved, now the new team, we resolved that we are taking this collective bargaining agreement to court for registration. So that registration process is what now brought on board the other parties, the Salaries and Remuneration Commission, the Council of Governors, and the Ministry of Health, and the Ministry of Labour also. And from that came out a judgment that was delivered on the 6th of October 2016. It's cause number 974 of 2015. Still remember that. And you can search it. And it had 6 orders. And one was that Ministry of Health was given the responsibility to negotiate and bring every stakeholder on board within 30 days. 45 days from the date of the ruling, 6th October, SRC to come on board, give their advice, and within 90 days, if none has taken any effect, the CBA would auto-register itself.
Would stand registered.
And that's where the contention came as to the validity of the CBA. Because on one hand, we had a judgment that was saying that our CBA exists. And so before the lapsing of the 90 days is when we called our strike in between after a lot of frustration. So that's when we called the strike.
So tell me what it looks like from the inside, huh? You guys, so you start off a strike, you have public goodwill for all of about 1 week, typical Kenyan style, and then the forces start to come at you. What did that look like? How did the government attack? Because you guys were attacked at very many different levels. I remember at some point there was a sustained onslaught in the papers around just the salary issues. At some point, the ethnic issue came up. At some point, the opposition alliance conversation came up. How did you guys manage to sustain this series of very, very, very well-programmed attacks? Let's start from his end.
I think the doctors owned the issue, because, as you have heard, since time immemorial, since 1969, there has been doctors felt that the government is oppressing them, and now this comes an opportunity. So, and the doctors had a conviction. So, whatever it will take, this thing must come. So, whatever was going on, whatever the government was attacking, it was also attacking a stone because the doctors knew what they wanted. They were focused on what.
But let me ask you again, Ismael.
Yes.
Didn't you guys have like a generational split? Because I'm very sure in the beginning, when we went from a viewer perspective, it was all young people. We never saw your senior. At what point did they start taking you guys seriously?
For the doctors, I think maybe the perception was that we were not together. But I remember even when we were calling on the strike, even in North Rift, it was the senior guys who were addressing the press, and it's only that the union leadership is young, but the membership is quite broad. Together.
In fact, before the strike was called on, we did a countrywide mobilization, and we sat with all the doctors from junior to the most senior of doctors. So the senior doctors were very much of the strike when it began, and they were very much in it. The only difference is, as he said, the officials, which is the face of the union, is us, the young doctors. But they were in it from the start, so we never had a generational split at any point in time. In fact, they understood the issues better, and most of them related to the 94 strike. And doctors who left the country in 94 and who are back in the country saw this as the perfect opportunity. In fact, in their words, they kept saying that we've never seen this type of unity amongst doctors, and we have to utilize this to the maximum level. That was one of the reasons why the strike kept on going despite the various attacks. The second reason was there was a lot of conviction from the officials first, even before the members.
Yes.
We knew what we wanted. The target was we want a collective bargaining agreement. Third thing was we constantly had meetings every single day. And so all these levels of attacks you're talking about, we'd sit down and analyze. And once we analyze, we realize this is what these guys are bringing to us, then we'll take this road.
Yeah.
So that's, and that played a very key role in not just us defending ourselves from this attack, but in the unity that was exhibited.
We knew what we expected also, because we knew what to expect from the government.
Let me just add and summarize that if there's a reason why the strike succeeded, it's because the senior doctors were in it, and they were in it fully. And just to give examples, is that even all of these things, you know the government is a monster. And even sometimes our buffer was the senior doctors, because you want to harm these young people, but then you realize as a senior government officer that your own doctor is in it. Because I remember meeting one of the doctors at Nairobi Hospital, and he told me, I have called the government spokesperson now, right there, and I've told him this. So if your own doctor, you are a very senior government officer, your own doctor is telling you, no, listen to those voices. Even the people who organized and even facilitated our meeting with the president were senior doctors. So they were in it as much as we were in it. And that level of conviction, and of course knowing the outcome and communicating very well. So things worked in our favor as a team, but the senior doctors were really in it. And we up to now, I've just mentioned to you, the senior doctors are really, really behind, and they really want to use this momentum to make some of the changes that they never had a chance to make because the constitution was not there.
So let's just pick up what a government strike looks like for anybody who perhaps has been inspired by the union action of the doctors. And there's certain expectations that we see at a public level, which is just basically political mandarins bad-mouthing individuals. But what does it look like from sitting within a union? What do those attacks look like? How does the government attempt to dismantle a union that's attempting to change the status quo?
I think the one word for it is nasty. It's nasty, and you really you must have a lot of faith to know that I went into this not for the attacks, not for fear, but to get exactly whatever you want. At some point, I have to say you have to become lifeless, because that also is part of the target. I remember we were, on the 7th day of the strike I was attacked. I still have marks on it in Eldoret. And
you were attacked physically?
Yeah, we were attacked physically in Eldoret. We had been trailed for quite a long time. And as time went by, it takes a different route. There's a lot of intimidation. The people who call you to threaten you. I don't remember any of us in the court team that weren't called to be threatened. One of our doctors was told that consider yourself, you don't have a job in this county. He was one of in the negotiation team. And some of us were told you are embarrassing your tribe. Some people were told you're playing opposition. So there was several levels. I think for me, I can't even count. I was trailed so many times. We, for those of us that were going for meetings, people blackmail you. They say, you are this murderer, you are a killer. They paint you in such a horrible way, to an extent that they remove that humanity from you. And one time we were told the government is a behemoth. It has several mouths. So sometimes you don't know what you are discussing with this mouth, but that other mouth is coming to bite you. So severally it's nasty. Sometimes I think we've not fully recovered to talk about it.
But let's just build up towards the jail, because you've got two things happening. First of all, public will is waning, and you've been directly blamed for what has been seen as deaths in the hospital, in the medical sector, at all levels. At this other level, you've been threatened with jail. At what point did you guys as a union, and I think Mwachonda sort of gave me some brief history when I spoke to him earlier, at what point did you guys set a union that this is it, liwe liwalo? Was it a collective decision made, or just spontaneously people just sort of found yourself called to standing up to a moment?
That was a collective decision.
Yeah.
And it was pre the strike, we actually prepared what we called frequently answered questions for our members.
Yeah.
And we laid out how the strike was going to play out.
Right.
And we knew that there was a court order that we had. And immediately we called off the strike, I think a day before the strike kicked off. It was on a Friday. The strike was kicking off on Monday.
Yeah.
Council of Governors went to court. And we'd anticipated that move. When they went to court, the next thing when we appeared in court was that you're calling off your strike.
Yeah.
And that's at that point we'd agreed, no, we're not calling off this strike. So we were prepared for that. So at the point of the first court proceeding, second court appearance on 22nd of December,
Yes.
in January is when now we were convicted and told that we were in contempt of court and that we'd been given a suspended sentence of a 1 month suspended sentence for 2 weeks.
Okay.
We had a retreat, and at that point we asked ourselves, if we call off the strike, do we have a CBA? No. Why did we go on strike? Because we want a CBA. So it became clear that the only way we'll get this CBA is if we go to jail for whatever period that had been issued by the court. That was a month. Then when we come out, we can actually now sit and discuss the CBA, knowing clearly well that jailing us was not a solution, because we knew where the problem was.
Yeah.
So that conviction of we want a CBA and the solution is sit down with us, talk with us, and give us a CBA. Jailing is not a solution. So the minute we determine jailing is not a solution, and that for once, if it means we go to jail for us to get the CBA, it's fine, we will go. And that's how we...
And we had prepared our members way before the strike. We went around talking to the doctors, and this was the message to doctors. This is what is going to happen. The government is going to go to court. The court will say the strike is illegal. They will say we call off the strike. What do you want us to do? Then we told them, at this particular point, there has to be decisions. So you, the members, must make decisions. As the leaders, we have made this decision. The leaders were like, we have no more solutions for you as far as leading this union is concerned, except getting that CBA. Because the issues that you want solved can only be solved in that CBA. Yeah. For us, we will go to jail. If going to jail gives you the CBA, because that's part of the leadership we signed up to, we will do it. Now for you as members, what do you want to do? Us as leaders, we are fine. If you members go back to work, we are fine. We will say that as the leaders, we wanted to do this, but our members opted otherwise. And we are fine with that. So we are very clear in our conscience. So the member said, if you people have decided this is what you will do, we will stand with you to the end. And they stood with us, and we thank them for that.
So it pretty much was a turning point. Where were you at the time when everybody else was being jailed? What did it look like from...
We were at the court.
You're at the court, huh?
Yes, it was an emotional moment. I remember we didn't know what to do, but we knew that it is going to be well, because a price has to be paid. At that time, we felt that our union leaders had paid the price for us to get a CBA.
So looking at sort of like historical context, and Mwachonda, you speak to history quite well, huh? Historical context of progressive, I mean, outside of our 60s, first of all, radical union leaders in the 60s who were systematically crushed. And through the 70s, almost the 80s and 90s, it's been very, very difficult for a union to achieve what you people achieved. If you sort of like just look back from in terms of context, what are some of the things that you guys got right that, for example, powerful leaders like Atwoli and all other unions that have represented large groups of workers have been able to get? What are the things that you actually got right in terms of lessons for anybody else who might have serious agitation on behalf of a core unit that could borrow from the lessons of the doctors' union?
The first lesson is if you're a leader, you're leading from the front, you first have to believe in what you want to achieve. You must have the conviction. That is where we started. Second, you identify the members, or rather the group that you're leading, and make them believe the same way you believe. You show them the direction. And communication is very key, because for us, communication is what held the group for the entire time. Because I remember at some point, even when government came really hard, all the doctors had retreated to a corner, and we had to tell them, you shall heal. That one came from the Secretary General, that we shall heal. So that in itself told them that in as much as all these attacks are coming, we still have to hold on to it. We still have to hold on together and believe in the cause. The other thing is, I think progressively over the years, because even if you go back to the story of Makansai, the father of unionism in Kenya, he was in jail for 19 years, by the way, for us to get the first trade union in Kenya. The democratic space has also expanded. Our Constitution 2010 has played a very big role in opening up the space for democracy for the labor movement in Kenya. So this also contributes to those factors that you as a union and as a leadership now have to decide, because the Constitution protects you. If going on strike, if a collective bargaining agreement is a constitutional right that is outlined in Article 41, then no one can take that right from you, unlike previously when they were not enshrined in the constitutions. So for the government, even if they want to crack down hard, you cannot deny your citizens their constitutional rights.
I want to direct a slight change to the same question. You guys are a little bit more than doctors. We all know you in terms of your professional capacity as doctors. But generationally, and I believe everybody here is, much to my surprise, is under 40. So you guys are basically the face of a new generation. Right now we have bandicad you as doctors, but you speak for entire communities. You speak for your members, your leaders in your own families, in your own. Just because there's a bit of a historical moment that perhaps you've not really appreciated. But now maybe you sit back from it, it's all gone, you have a signed CBA. The victory is not done yet, but at least you won one battle. Just in terms of your generation, what did that mean for you?
And yeah, I really like that question. It's a really good question. First, going back to the issues of as a leader and the history, I think I'll just make two comments. One is from the leadership perspective, there's just the issue of integrity. So integrity includes conviction, not giving in, telling your members the truth, telling the public the truth, because you owe that truth to yourself. From an organizational perspective, and like the Doctors Union or KMPDU, there's just one thing, unity. And you're not going to achieve that unity if you leaders don't have integrity. Because the members' resolve comes from, the human beings are very nice people, like doctors, for example, they can see through you. So they can see when you believe in what you're telling them and when you don't. So you're not going to achieve that unity if the membership have doubts in you.
Yes.
That's the first thing. So I think, to me, those are the things I can say from historically. There's a lot of doubts about trade unions. Yes. And we proved, and I think what we want to do is also to make the trade unions have their place in society, and coming even to our generation. What I keep saying is that there's a generation that came way, way before, the generation of tomboys, you know. They gave us all these institutions. They gave us the NHIF, they gave us the NSSF, they gave us, by the way, even the court that jailed us was a creation of trade unions. It's a creation in 1965 when Tom Mboya was, you know, the leader of the Kenya Labour Federation. So the court itself must remember that they are a creation of a trade union. And so looking at all of those things, and that is why for us we were very clear that, you know what, our generation must solve the problems of our generation. No one is going to come and solve them for us. So if I say this sometimes, where I come from, for example, there's no doctor in that constituency. So I owe it to myself and to them, because our people still live there, to make sure that they equally have a right to healthcare. That right does not come without a doctor, come without an access. And because these people are very poor people, they're not going to bargain, and there's no doctor who's going to set up their private. So there has to be a responsibility. That responsibility has to lie on the state. That state is the government. So the government must employ a doctor to make sure that that mwananchi down there has access to healthcare. We owe it to our generation that we achieve that for them. We owe it to our generation that the issues of employment, the issues of quality of healthcare, that I am not going to America to practice medicine in America and get paid well. And by that I'm saying that because I've done the exams for America. But we choose to stay and say, we are going to solve these things here. And for me, I think that's just the message for our generation. All these people sometimes in government, sometimes they don't know what to do, because sometimes they have fought their struggles. Sometimes their struggles was to bring that constitution. Sometimes their struggles was to open the space. Sometimes their struggles was to ensure that we have medical schools. Now that we have 9 medical schools, what are we going to do with them?
So it's something, the ground shifted.
And the ground has shifted. And we've said this to even very senior government officers. I'll not mention them. I kept telling some very senior government officers, you're not going to stop this momentum. These younger doctors and this generation have decided they will do A, B, C, D, E. The best you can do is either facilitate or join that movement.
The whole year, only 2 months have public hospitals been operational. As a joint conclusion, I want each one of you to sort of like speak to what ails this country and what you guys as a doctors union see as not really the end game, but the way out. Yeah, and perhaps we'll start with Ismail.
I think what bedevils Kenya is the selfishness and the greed of our leaders. And I think the reason why public health care is like this is because the people who make decisions do not utilize those facilities. For example, the Minister of Health could be going to a public facility, then he could feel what it means to not have those services. So I think what we need to have as a country is health should be a basic right to everyone. And when you deny whatever level you sit, ensure that everybody is able to access that health care. And it should be affordable and accessible. So the leaders should actually be able to utilize those services so that they're able to feel what the common man feels.
Okay. Look, in regard to, say, like, for example, the nurses now and the clinical officers, what would you speak, what do you say to them?
Yeah, it's a very unfortunate situation for the whole of the healthcare industry. Actually, the system has suffered so much that it will take us a few years, even with the CBA, to repair it. What he's talking about is really the core of it. Health as a public good versus health as a commodity for profit. So there's a lot of drive to commercialize healthcare, and then there is the need to just have health as a public good that you give, and it's right, and that health generates. Health doesn't just consume, because those hospitals, you know, healthcare in itself can be a third of the industry of this country. And you don't even have to say that healthcare will produce employment and all of this. No, just having healthy people, they produce so much. For every 1 year lifespan, because that's how you measure the health, for every 1 year lifespan you add to a population, you can actually multiply the GDP by 4. If you look at counties like Siaya, where the lifespan is in the 40s, you know, 43, 45, look at the orphans that people are living. Then you look at the poverty that is caused because of those deaths. Then you look at the lack of schooling for those children. So you are basically wiping out a whole society. It's a major ripple effect for health. So health produces jobs, health produces GDP, health builds the economy. What is the problem? The problem is lack of political will. That is the absolute problem. And that lack of political will is complex. Sometimes it's because there's a drive to profit from health, which is a very small bit. Then on the other hand also, there is basically what he says, they don't consume it. I don't go to, you know, at some point it's very funny. Let me just be straightforward on this. All the leaders, all of them who make decisions about wananchi do not at all consume those services. And this one we had one point during our strike. We said, so all of you at the other side of the table, tell me when was the last time you walked to Kenyatta National Hospital? For me, for him, and for him who are negotiating with you, we were working there yesterday. We saw what the patients were going through. When was the last time you saw a patient at Kenyatta National Hospital and what they are going through? That is the problem. So all these people are completely detached. So they go to their offices, they see those policy issues. They don't think that those things can make change. So they don't understand that the positions they hold mean life and death to someone. And so the issue of, and that is the same thing with the nurses and the clinical officers. So to this leader, they get mad or they get annoyed and they think that they're being slighted or they're being undermined. And they look at these nurses, what do they think they are? They're just on strike. If you do not care about the nurses' strike, you do not care about healthcare. Because you can't divorce the two issues. You must provide that nurse to the mwananchi. And in essence, you also do not care about the life of that mwananchi. So there's no pretense about it. You either sit down, and nurses and doctors and clinical officers, we are all professionals. And we said this even during our time. Please sit down with us. We are going to negotiate. Tell us if you want to do it in 2019. We will sign. Didn't we say that? So there was this, even this narrative in the media that we are adamant, we want it now. Actually, quite the contrary. We said, you tell us, when do you want to do this? Are you comfortable doing it in 2020? We will sign and say, you will do this in 2020. But you see, ignoring it doesn't solve it. And there is that notion. So the leadership have absolutely no political will to make healthcare work, and that is why the nurses, the clinical officers, even the doctors were being ignored. For us, we made sure you are not going to do anything about us without us. And from now henceforth, there is nothing that's going to happen in this health sector for doctors, for patients, without us. And that's the message.
What does the future look like? For you're in it now, you're in your 30s, man. What does that look like?
This is how I say it, that the future looks like in two ways. What is the future of healthcare in Kenya as we stand right now? If you analyze, the future is bleak. Why do I say that? The future is bleak because there is a tendency and there is a shift that is being driven towards privatization of healthcare against public healthcare. The education system has gone through the same in Kenya. So if we are not careful in Kenya, if we don't have people who will come out and say, no, we are not going to accept that our public healthcare system is going to be thrown down the drain, then we're going to have a problem in this country. For us, we're in it. This is the beginning. I as a team, we look at it in terms of healthcare reform agenda. And that's where we look at it. The WHO in 2007 came up with what you call the management for health systems. And there are key components. There are 6 building blocks. And at the center is leadership and governance. And that is what is lacking in this country when it comes to healthcare. The entire world is now moving towards universal health coverage. In fact, in the States, they presented a universal health coverage bill that is also facing opposition. Yeah. So these problems are not unique to Kenya. They're even happening in the American system. So it's important that we have recognized our role and we are willing to play our role in healthcare reform agenda in Kenya. And that is the space that KMPDU wants to occupy. And I can assure you the CBA is just a part of the bigger healthcare reform agenda that we want for the country. We are looking at it from the terms of healthcare financing, human resources for health, supply of medicine, essential medicine, and vaccination. And in fact, vaccination has been a big problem this year. You can imagine that for the last 3 months, children being born are not being vaccinated. Mothers do not have access to facilities. So our maternal mortality rate will go up. Infant mortality rate is going up. In the next 5 years, TB outbreaks are common. We've seen cholera outbreaks. Yeah. In the next 5 years, you're going to have children who are suffering from vaccine-related diseases that could have been prevented. Yeah.
Even just pneumonia.
Even pneumonia. So, in essence, we have to rethink our healthcare in this country, and someone has to stand up and say this is the way we need to go. And that's what KMPDU is all about.
First of all, thank you very, very much for making time, and thank you very much for those really comprehensive and deep answers. And most importantly, just for your examples and leadership. And it's as a guy who's been in the trenches for a couple of years, it's very refreshing to see a whole generation of guys come up and take causes for national cause at this level of conviction and integrity. So I suppose in closing, for the elephant, for those who have perhaps watched this podcast and would like to sort of like follow what you guys do, to stay informed and sort of like increase their breadth of what health reform really entails and how they can get involved in some way, how would they stay on track with what's happening within the union or the broader health sector? In terms of your Twitter handles, in terms of a functioning website, perhaps a Facebook page? Yeah.
So thank you very much for this opportunity also. I think it's one of those platforms that we get to, again, engage people and how to get people involved. Healthcare now, we actually need everyone. Healthcare must be everyone's business. It is not just about us. And we are just occupying this space because it's the bigger problem that we think we can solve. It's what we are making the agenda of our generation and the agenda of our lives. But to everyone out there, in fact, healthcare is so personal because I don't know anyone who can say that they don't know a relative who they have not seen suffering because they couldn't access care. So there has to be some level of unanimous involvement in health, whether it's through messaging, whether it's through art, whether it's through campaigns. But for us as a union, as he said, we want to do this health reform agenda where we'll be meeting these groups of people, whether they are parliamentarians, whether they just want to, and we are thinking of building a people's health movement, a very powerful people's health movement, so that if the people decide that Kenyatta National Hospital must work, irrespective of who is my leader, Kenyatta National Hospital will work. That involves the people. That involves that person who is watching us. That involves that person who probably is just going to tweet. And myself, I'm active on Twitter. We have a Twitter handle at KMPDU.
What's your Twitter handle?
My Twitter handle is at FN Oluga, FNOLUGA. And we get engaged and we engage people. And the other thing is that it's not just on Twitter. There has to be also physical. At some time we organize what we call beyond the Twitter. And you have to show up sometimes. You have to show up you have to tell the Ministry of Health, you are not doing it right. You have to tell your leader. And sometimes people have to stand up to their leader. You must know that your MCA makes decisions that account for your health, whether in public or in private, because sometimes Kenyans, we escape and think that I will be able to pay for Nairobi Hospital. I will be able to pay for this. But do you know that the cost of health insurance is determined directly by the level of health care provided in the public care? So if there's no care in the public sector, your insurance is so expensive, and it is, in my own opinion, so useless. We call it plastic insurance. So you want this 500,000 to be admitted at Aga Khan ICU, but your insurance is offering you 500,000 for a year. So that is deposit. So,
one stop little bit.
Yes, so the effect of all of that, the cost of employment is higher, and that means that, so your employer is using more money to buy you insurance instead of employing someone else. So when our unemployment rate as youth is 40–50%, it's because the employer has decided to buy you a very expensive insurance which could have employed 2 other people. So the ripple effects of health is everything. I can talk about this for so long. So there's a lot of involvement.
We have a Twitter handle at KMPDU. My personal Twitter handle is at Mwachonda Chibanzi. We don't just tweet. We are also involved in trying to create awareness. In fact, in the 7 prisons that the 7 of us were held, we've launched a medical camp drive. We've done one in Langata Women's Prison. We are still planning towards the end of the year and early next year to do the 6 remaining prisons. We are looking at making sure that we get involved in decision-making level, from both national and county levels, where we have our branches, and we are in the process of empowering our branches. You mentioned a website. We've had so many battles ever since we started our union.
Yes.
So our current website does not really reflect the place we've gotten to, but we're in the process of restructuring that website, where you'll be able to now fully understand the mandate of KMPDU. I think we've gotten this platform that is KMPDU, and so we will be able to engage you more. Social media is one of our strengths.
Yes.
In fact, that is what really ran our strike. So social media, we will be starting a YouTube channel very soon, where we'll be having these discussions of health and labor.
All right. Gentlemen, thank you very much. Thank you very much. Dr. Mwachonda, Dr. Oluga, Dr. Aiyabel, thank you so much. More power to the cause, and keep on preaching the good news. Huh?
Thank you.
Okay. Well, I guess that's it for us here at The Elephant. Please subscribe. There must be a link down here. And catch you in the next podcast. Thank you so much.